Hello, everyone, and welcome to the Shining Light video podcast show, where I shine a light on my guest and the positivity they're spreading in their communities. I'm here with Leah Feldman and a special guest who I will introduce momentarily. But Leah just ran 52 miles on Saturday to raise awareness for mental health and for her cause, 52 End Stigma. And she's raising over $52,000 to do so. Leah, where are we at with the numbers?
We are close. We have about 8,000 left to go to get us over that finish line. And Michael, I got to give you a big thank you for waking up at 5 a.m. and running the first several miles with us, as you did last year as well. You were a light, and it was totally dark, but you brought light, and your motivation and your positive words really uplifted us and set us off on a really, really beautiful journey for the day. And so excited that one of our largest supporters, Nuvance Health, is joining us today, Susan Browning. She has been a supporter since day one. Last year, Nuvance and Susan herself supported our 50-mile campaign this year. And what a better person to talk about how important mental and physical health is and how they intersect. She sees it every day as president of Vassar Hospital, and has seen it throughout her entire career. So really looking forward to her sharing some of her expertise with us.
Thank you, Leah. What better introduction than to get an introduction from Leah Feldman, CEO of Family Services. Susan, welcome to the Shining Light. As Leah just mentioned, you are the president of Nuvance Health and of Vassar Brothers Medical Center. And in your journey through there, you've worked with so many other organizations, other hospitals. And really what stands out to me is the connection between the mental and the physical. And I'm curious on your thoughts on that.
Oh, my goodness. Well, they're just inextricably linked, Michael, as Leah knows. And you can't have full mental health without the physical health. You can't have full physical health without mental health. When we look at our communities and we look nationally, 1 in 5 individuals is afflicted with some degree of mental health. 1 in 5. So 20% of our communities, of our families, of our friends, and to different gradations. So there are those that we will look at and we can observe and we will know, yes, they are indeed suffering from mental health impediment in some way. And then there are those that are completely integrated into our communities, into our families, into our lives, and we have no idea. And so how do we develop plans in order to really meet patients where they are and help patients across that journey? What we find is that when a patient is more physically fit, when they're eating well, when they're exercising, when they are supported emotionally by a family and friend network, they can handle things from a mental health perspective much better. When individuals have strength from a mental health perspective, they can handle physical afflictions much better. When they're afflicted with mental health, it impacts their physical health, their outcomes, their clinical outcomes are impacted. So the two are really linked. We can't separate them.
And when you're seeing this in the hospitals, in terms of linking these two, how do you see the 52 End Stigma campaign that Leah has really spearheaded as of last year, and she has her wellness warriors now. She had 5 people run with her this year. She's so ambitious. She envisions 100 people running with her soon. And I'm feeling like maybe a year or 2 from now. How do you see that connection with everything you just said? The 52 with Vassar. So
it's exactly what it's characterized as, 52 to end stigma. The more that we are talking about it, the more that we are normalizing what is happening already within our communities, the more we can address it. So when we're not talking about the 1 in 5, when we're not talking about there are so many different ways in which mental health issues are evidenced in the population, when we're not recognizing that, then we're not addressing it. And then when it is stigmatized and we cannot address it, we see all the ramifications of that throughout society and throughout our families and throughout our friend networks. So by having the conversation about it, by making it a normal part of an assessment, for example, somebody goes to their physician, they're sitting down with their primary care physician. We're talking about your eyesight. We're talking about the sugar level. We're talking about How's your heart doing? We need to be talking about as well the emotional state, the mental health of all of those in our population, in our communities.
Is that part of regular screening when someone comes into the hospital? I know earlier in my career, I worked with hospitals on screening for matters of safety in the home, domestic violence. Mm-hmm. What type of screening is happening when someone enters regarding their mental health?
So if they come into the emergency department, for example, depending on what they are presenting with, that certain questions will be asked in that screening. If they are admitted into the hospital, it is exactly as you're saying. The social determinants of health are part of that screening. So the nurses, the case managers will be assessing for food insecurity, for the ability to secure appropriate transportation, whether or not that patient has housing, what are their family situations like, and all of the factors that influence not only a potentially positive outcome from that, that specific admission, but what we're looking for is to appropriately transition a patient into the community or to the next level of care. And we need to understand all of the other factors that impact that.
One of the big things that comes up in terms of everything you just mentioned there is supporting your staff. So when we're thinking about this, we're talking about cardiologists, we're talking about orthopedists. They have specialties in places outside of mental health. So how do you as an organization, how do you, Susan, how do you support your staff in being able to bring up some of these tough conversations? Because, a doctor who is well suited in talking about the heart and understands that really well might be a little bit more reluctant or uncomfortable to bring up the mental health side of things. So how do you support that in your role?
So from the physician perspective, if a patient goes and makes an appointment with a physician's office, for example, in the primary care setting, what we are doing on an increasing basis is we are adding in mental health resources right there into the primary care setting, linking them in, or providing training to, say, a nurse practitioner that is part of the primary care group, so that there is an added competency within that practice to be able to make an assessment and be able to make a recommendation and get that patient into the appropriate level of care if what they need is ongoing psychiatric care. So that it becomes, again, part of that fluid conversation where that relationship is being developed. From a staff perspective, we have a myriad of resources to support our staff. We've got provider care teams, so that if somebody's having a really, really tough day, an individual is having a tough day, they can go over to anybody on the staff, and we have 2,500 employees. And we have certain employees that are wearing a badge that says PACT on it. And they're part of that care team, and they can be pulled aside and have a confidential conversation one-on-one of, hey, I just need some support today. I'm having a tough day. This is what's going on. So that's one-on-one. When we have a situation with an entire team where, maybe they had a patient that was on the floor that had been with them for 6 weeks, and everybody knew that the outcome or the prognosis of the patient was not going to be a positive outcome. Patient had cancer, patient had a heart disease, and now that patient unfortunately passes. That has an impact on the care team. We can't be in a position of saying, well, just leave it behind. It's that's work, and you can turn it on and turn it off, because we're human beings. We don't ever really turn anything on or turn anything off. So we also have what we call in the hospital code lavender, where if we do have an outcome that impacts an entire team, a team goes to them who are trained to do a code lavender, and they do a debrief with the team, and they just have a huddle with the team, and they give the team some time to have some coverage and just collect themselves and talk amongst themselves and really be able to empathize with one another and support one another, so that from a human to human perspective, we're supporting each other. We also have what we call our employee crisis funds. So we have, for employees that have been impacted, say an employee who had a house fire, an employee who recently lost a spouse and they've lost a source of income. They can make an appeal to our employee crisis fund that is funded by outside donations or funded by other employee donations. And they're able to get some money and some support to help them bridge them during a period of time. So we have that as well. So we have myriad, different levels of support throughout the organization, depending on what the situation is.
Yeah, that's excellent. And I'm thinking about Code Lavender. I'm thinking about this fund that you're talking about, and kind of maybe my last question in terms of like the hardball questions, and we're going to get into some more fun and some movement type of questions, is where you stand. You're seated between Nuvance Health, Vassar Medical Brothers. You're in this health space, so obviously mental health and physical health, as you said, they're linked. They're very important. When you think about other organizations in our Hudson Valley region, or even worldwide, nationwide, as far as you want to go, what maybe 2-3 tangible takeaways can they take in terms of what you do in your organizations, speaking to the lavender, the grant, the fund, of things of that nature?
I think the most important thing is that we need to think of ourselves as a community of caregivers. So where Nuvance Health and Vassar Brothers, if I think about it just through the lens for a moment of the hospital, and of course Nuvance Health is comprised of ambulatory locations, post-acute hospitals, physician offices, we have the whole gamut. But when I think about Vassar Brothers Medical Center and the care that we provide, we're providing a segment of that care along the continuum. And a patient may enter at any one point, and then they're going to need care when they leave us. And some of the care and some of the support will be provided by entities and services that are offered by Nuvance. But we can't be everything to everybody. And there are community-based organizations. There's family services, for example. There are other mental health providers, and family services is many. It's not just mental health, but there are other organizations within our community that solely do mental health. How do we all work together so that we can come together as a collective of organizations and really embrace and provide the care to the patient holistically? And each of us do our piece of that. But we work together to elevate the care that is accessible to the patient overall.
Awesome. Thank you for
I think
that.
what Susan just described is this idea of whole community wellness. And gone are the days where organizations, health-related organizations, operate in silos, right? The hospitals cannot be successful. The patients going to the hospital cannot be successful if there's not a myriad of wraparound support. And I've always been so impressed with Susan, because within the first 3 months of her taking on this massive job that she has, she was out in the community meeting providers, and that, like family services, to say, when people leave the hospital, where are they going for that long-term care, and how are we ensuring that people are thriving and not just returning back due to chronic illnesses, whether it be physical or mental. So we all have to come together. And, that's so much of the theme of our 50 to End Stigma, was when we come together as a region, we truly do thrive with holistic health for every single person that lives in the Hudson Valley region.
Yeah, it's all of these partnerships that really highlight the movement in our different communities. So speaking of that, Susan, tell us about your movement over the months of October, your teams. Have you guys been running? Have you been biking? What kind of movement have you seen in terms of physical activity?
We've got a lot going on right now. We have our Oktoberfest right outside the doors, and we're celebrating the month of October, and we've got all sorts of activities that the employees are out and about and they're enjoying. But to Leah's point, really partnering, we had a particular employee, and Leah and her team highlighted our employee who decided she was independently, she heard all about 52 End Stigma, and she independently put together a team. And she quietly did this. She didn't tell anybody that she was doing this. And she and her dog were out walking just about every night. And Leah she mentioned it to me. We were at a community event on a Sunday, and she mentioned it to me. And by Monday, this particular employee was throughout the hospital. We put her out onto our intranet, and we really made it a whole event that, come join with Nicole and you can help sponsor this. And we really were able to get a lot of excitement about what Leah and her team are spearheading in the community. We just brought it back in-house and kind of redirected it in. So we had a lot of activities underway here with our employees and a lot of excitement about it.
That's awesome. And you guys are, of course, a sponsor of not just 52 End Stigma, but of course, family services in Poughkeepsie, which is obviously very, very much appreciated. Susan, it's been a pleasure having you on today. And Leah, I'm going to come back to you now. just in terms of your run. Susan, you might actually be helping Leah and her team out in terms of this. Leah posted just the other day her runner's aftermath after running the 52 miles. So Leah, how did you feel, and what were some of the things you did in order to recover from running 52 miles in one day, which, by the way, everybody, was to raise $52,000. They're $8,000 away from their mark. So visit 50, the number 2, and stigma.org in order to make a donation, learn more, and share it with your friends. Go ahead, Leah.
So it actually ended up being 53 miles, but who's counting? 53.13 because we miscalculated a tad. However, it's going to sound a little old school, but water. Water is the biggest thing that can help you recover. Rest is great, but I have 2 toddlers. I don't rest. So it's been water and interestingly salt, right? Because you have to make sure you have a good electrolyte balance. I always say water, it's the most adult thing you can drink. And you should just continue to drink water, and it's beautiful. It's going to help you heal.
I agree. And by the way, just a little correction in all of this. I want to make sure that everybody's well aware. It was 3:30 in the morning that I woke up, Leah.
Oh.
That alone gets you an award, Michael.
Right? Come on, you know?
He was unbelievably energetic at that hour. It was shocking. Just shocking.
I remember when one of your wellness warriors said that to me, and I was just like, well, you know, I'm a little weird like that. I'm sorry. Susan, before we wrap up, I'd like to give you final thoughts.
Oh gosh, final thoughts. How do we encapsulate all of this? You know, I think just as a community, we just need to keep mental health front and center. It is nothing to be embarrassed about. If you need help, ask for help. It is as important as your physical health. And I just congratulations to Leah and your team for doing what you do.
Thank you, Susan. And we can't thank you and New Vans Ambassador enough for your partnership. It truly is a beautiful example of how to come together for the community. And that is definitely due to your leadership. And we're just so thankful to know you.
Thank you.
Awesome. Thank you so much, Susan, for coming on the show today. Leah, of course, always a pleasure. This has been the Shining Light Video Podcast Show, where we go live every Thursday at 1 p.m., highlighting amazing people. So speaking of amazing people, we brought up the Wellness Warriors. Next week, 1 o'clock, live on LinkedIn, YouTube, Facebook, and sometimes in person. So those of you who know, you know who you are. Next week, we will have our Wellness Warriors on. They ran 52 miles with Leah. I had the pleasure of meeting them. I only ran about 5 miles with them. I had the pleasure of meeting all of them. They were amped up at 4 in the morning, 5 in the morning to go. And then I did see their post videos and they were hurting, but they did it for a great cause. So it's so exciting to have them on, learn about why they did this with Leah and how it's impacted their lives. Susan, thank you for all the work you do. Thank you for coming on the show today. Leah, you're amazing. You talk about a shining light. You are a beacon of hope and light. Thank you for coming on the show today. Stay happy and stay healthy, everyone. And we'll see you next week at 1.
Thank you.
Thank you so much.
Bye-bye.